Before I talked about sciatica and pain down the back of the leg or down into the lower back coming from either the lumbar spine or the pelvis. And one of the most common questions that I have is, how can you tell the difference between the two? So I decided that I would show you one of the basic ways that I can find out that you can do on your family so they know whether or not they have a problem with the lumbar spine or the problem with the pelvis. And I'll show you exactly. I'm going to sit on one of my chairs and then I'll show you exactly what it is. I'm going to try to show you what I'm looking for so you have an idea. First off, the vertebra doesn't move the way it's supposed to move, so the restriction of motion will be obvious. So if a person sits down and they have pain in the back or down the leg, and they bend this way, and they bend this way, and the spine stays stuck, it won't move, that's indication of a lumbar problem. A lumbar problem. If a person has a pelvic problem, they'll bend fine, and then their lumbars will move, but then their tush will raise right off the chair. They can't get that off. And the interesting thing is that the lumbar problem will always hurt sitting down. It'll bother them in the car, it'll bother them on the couch, it'll bother them in an easy chair, but the lower back hurts. Sitting makes it worse. But if it's a pelvic problem and the sacroiliacs don't move the way it's supposed to, it'll bother them most when they stand. So one of the most common things that I'll ask a person is, would you rather go to the show and sit for 3 hours or go to the Fox Valley Mall and walk around for 3 hours? And they'll tell you right away whether it's the pelvis or the lumbar disc.